CBT roughly mean is a structure and evidence-based type of therapy that shapes how we feel and how we behave in terms of autism. It contains behavioral therapy, cognitive therapies, and social skill training too. So it combines many different types of therapies under the same umbrella. And it also is founded on educational therapy and cognitive therapy. So we know this chart already. Our thoughts shape our feelings, feelings shape our behavior, and that in turn affects our physical reactions, how we act upon certain life situations, and thoughts in turn there are schemas that settle down since the childhood as well as certain beliefs, and anytime we have some automatic thoughts that are also included in this concept, it is quite effective. Especially CBT is effective in anxiety disorders as well as in many other disorders. In psychiatric conditions, it's frequently used, and this new conditions will be added to this list with every day. In the past, the way we thought was psychotherapies and neuroscience are completely separate from each other, like in opposite corners of the ring. That's how we perceived it. We could never imagine that the two could be linked to each other. However, during my residency, I read a publication of Kandel. And this publication is an important paper, and it really was life-shaping for me. It discussed the basic principles of neurobiology, and for you it has a historical value. And in terms of principle, it said behavioral and social factors will affect me using feedback mechanisms, and thus change the gene expression in the brain and will alter the functions of the neurons. And there is a gene alteration in the gene expression, and principle 4 says learning alters the structure of neuronal connections and thus expose the alterations in gene expressions. There was also a reference to psychotherapy. Psychotherapy creates a long-term change in behavior which will augment the power of the synaptic connections and thus change the anatomic structure of the nerve cells in the brain, and it will be mediated by a change in gene expression. I think this paper opened a new era. Today, psychotherapy and neuroscience overlap each other. Especially CBT has made a great contribution to this concept because CBT is evidence-based as well as structured, and thus it's easier to conduct studies on CBT. And it is easier to demonstrate its effectiveness. If you look at the studies that have been conducted, we see that most studied subject is what kind of alterations happens in the brain when we give CBT to a patient. This is the mostly studied topic. So when you just make a search about CBT in depression and even in schizophrenia, we have before and after CBT changes in the brain in terms of function as well as structure. But now the studies have moved one step forward, and now they are looking at which component of CBT is more effective. Is it the cognitive component or is it the behavioral component which alter the brain most? And so what the mediators are that mediate the effect of CBT on different brain functions, and which patients are good candidates for CBTs and which patients are good candidates for medical therapy, and they are looking at possible predictors to answer these questions. Even individualized psychotherapies are being tested. For example, patients with depression, anterior cingulate cortex, especially the rostral aspect, if there is an increase in activity, we can predict that these patients will better respond to CBT. Or in case of orbital cortical cortex is very important. If there is a reduction in its activity, these patients again respond very well to CBT. If there's an increase in the activity, maybe we should opt for medical therapy instead. Thus, we can provide individualized therapies, and this is an important study to identify the right treatment for the right patient. How does CBT alter the brain? One, it has an effect on learning. Secondly, it has an effect on emotional regulation. And of course, it also affects cognition. And some of the effects are mediated by epigenetic factors. Instead of going into the details of individual studies, what I would like to just share my conclusions from those studies. First of all, CBT is a learning-based therapy, and thus it activates the hippocampal synaptic plasticity in the prefrontal cortex. It has an effect on neurotransmitters and regulates the working memory, and it also activates latent synapses. Thus, CBT is creates a learning-based plasticity. What are the main components of the learning-based plasticity? Use it or you lose it, use it and improve it. Timing is very important, repetition is very important, the intensity of the stimulant is important, and generalization is also a required factor. As Didem just explained, why do we want the patient to be generalized in certain conditions? Because it's learning-based. Or in case of ADHD, behavioral therapies work better in the young ages, whereas they lose their effectiveness in advanced ages. This underlines the importance of timing. It's like learning the piano when you're a small child. So it creates an improvement by learning, and second, it regulates the emotions of the patients. CBT does not affect our thoughts but our emotions, and recently this is the general consensus that it has an effect on emotional regulation. Emotional dysregulation is important in many different pathologies. Many patients, in terms of recognition and perception and conceptualizing of external events, is important. Here attention plays an important past experiences play a critical role. How they will be interpreted and where they are stored are very important. And perception, emotion, cognition cluster is automatically, however, perception, cognition works slower. It's a bottom-top as well as a top-to-bottom. Systems are important in terms of processing the emotions. This bottom-up approach is under the influence of amygdala. It's faster, it is all or none, so it makes a rough evaluation, and it induces rapid learning. Its fight or flight response is also created in this segment. The top system involves the frontal cortex predominantly. Orbitofrontal cortex, anterior singular concepts, especially for emotional regulation. Mental medial prefrontal cortex play an important role. And I have my favorite structures within the brain. Probably that's because I'm an obsessive person. Anterior cingulate cortex is my favorite region. I mean, it has 3 different parts. One of them has to do with cognition, so it's about checking, it's about control. The anterior part is mostly involved in a checking function for the emotion, and the dorsal part checks what has already been checked. So ACC this region is critical for the ACC, and thus both cognitive as well as emotional issues are seen in those conditions, and these are the most important components of the system. It's slower. It has to do with a slower learning process. It's more detailed, and it can be expedited with exercises. So what does CBT do? It reduces the activity in the amygdala hippocampal subcortical region. It tells the amygdala, come on, slow down a bit. Don't react immediately. It reduces its excitation, and it makes the frontal area more predominant. So it just takes over the control. In terms of emotional control, it's a bit more detailed. It don't respond too quickly, and in case of anxiety disorders, frontal striatothalamic activity is reduced. In anxiety disorders, disorders are more extensively studied, including its effect in depression is not that clear. However, here the ACC and MPFK are the areas that have the greatest function in terms of regulation. So when you give CBT to those patients, this region is mostly affected. This is an old study, but it is easier to understand using visual images. In the first image, we see before medical therapy and CBT, we can see that this amygdala is more active. It is illustrated in red. After CBT is given, the frontal area becomes more active. Medical therapy, on the other hand, work from bottom to top. So they have to exert their effects on amygdala and reduce its activity. And of course, if you want to have a synergistic effect in this case, we have to make prefrontal cortex more active by using CBT, and at the same time we have to suppress the amygdala using certain drugs, and thus a synergistic effect can be produced. Another mode of action is the metacognition. It is thinking about thoughts. This has to do especially about mindfulness. We have a lot of studies on this. Mindfulness is to focus on the existing action. You may translate it as be mindful of your environment. It's a CBT approach. It is based on Zen philosophy and Buddhism. However, it has also been incorporated into this concept of CBT. Mindfulness CBT, especially on EEG, reduces the alpha and theta activities. It regulates attention and thus increases the activity in PFK and ACC. Thus, through metacognition, alterations are produced. And a fourth way, whether it creates a change through the genes, are psychotherapies on epigenetic medication. And now this question has become popular. Now I will share some of the more recent questions. One, in psychopharmacology, this is quite important because this question was asked by Stahl, because he's one of the leading figures, and he also supports the view that it is an epigenetic medication. Let's remember what epigenetic is. Epigenetics is, without making any alterations on the DNA sequence, it's a gene expression change that is transmitted by changes in meiosis and mitosis. The effect may be direct or indirect, especially DNA modification or histone modifications could be epigenetic changes. This is the DNA structure. DNA is wrapped around the histones, and histone modification changes the structure of the histones, and DNA is methylated, and thus its structure is changed without altering its sequence, and thus this also changes the way it is expressed, and this change may be transmitted over up to 4 generations. Maybe a CBT that we give to our patients will have an influence on the genes of offspring. Here we have 3 important studies. The first study, this is the first publication that I read, is on borderline patients. Negative early life events increase the BDNF methylation. So epigenetics can produce a positive result as well as a negative result. And especially in 115 patients with borderline personality disorders before and after CBT, and here behavioral therapy is used. The gene methylation rates that encode for BDNF are studied, and responders have been shown to have less methylation, and thus the production of BDNF is increased. Another study was published by Yahuda, and he especially works on FKB P51. Again, these are patients with borderline personality disorder. Again, they look at the genes that encode for glucocorticoids, and they give extended exposure to the patients, and before and after the exposures, these genes and their methylation are studied. In 2 gene regions are studied. In one of them there is no alteration. However, in the gene that's called FKBP5, they identify an alteration, and they associate this with the treatment response. And psychotherapies define it as an environmental regulation. And this is a study on children that was published in 2014. This is in children between 6 and 14 with anxiety disorders. In responders, serotonin transporter promoter region, and there is a increase in DNA methylation. This is an important piece of data for us. But I still have some questions in my mind. For example, these effects by the CBT, do they really normalize what is pathological, or is it a side pathway that is a compensatory mechanism? This is a question that I have. Is it really specific to the CBT, or do we see similar things with other psychotherapies, especially in terms of interpersonal behavioral therapies? There are some studies, and there's also one study on psychotherapy, and the results are positive too. So the brain structure is altered too. As I said, does each technique of CBT show the same effect? Especially a there's a study that was started in 2010 in panic disorder patients. What I've just shown you about those brains, remember this illustration, and they get response. They look for response in all of the stages. The study is conducted in around 300 patients, and the publications are starting to come out, and they are very interesting. And there, the patients, so if they do a self-exposure, whether the response is different in the brain, or if it's done together with a therapist, the exposure, whether the response is different. This is what they are studying. Maybe there's a question whether this effect that is produced by CBT is the same as with cognitive therapy, or with computerized CBT. Can we create the same effect? I think these are the areas that need to be studied. And there was one more question that just popped in my mind. I wonder whether CBT is producing an alteration in the brain of the therapist himself. Thank you very much for your patience.